Hi, everyone. It's great to see you here with us tonight to talk about this extremely exciting topic about something that's very important to all of us, healthcare, the health of our families, our communities, and our patients, the revival of our medical practices and our profession, holistic practice. So I'm Dr. Charles Elder. It's great to be here. I'm the Executive Director of the Fellowship in Integrative Medicine and Ayurveda at Maharishi International University. And we're going to talk about what we do tonight. And here is the agenda. It's very straightforward. We're going to start out with some introductions. Okay, David Lonsdorf.
Hi, I'm David Lonsdorf. I'm the administrative director of this fellowship, and I live in Land O'Lakes, Wisconsin. I started my journey with all of this by becoming a TM teacher many years ago, and I also had the great pleasure to be the administrative director of Panchakarma clinics for over 25 years.
Thank you, David. Dr. Walt Mills.
Hello, Walt Mills here. New on this faculty, having been involved in teaching for a number of decades.
Family medicine. Great to have Dr. Mills with us. A big boost to our team. Dr. Shankri Wegman.
Hello, everyone. My name is Shakri, and I'm the Assistant Director for the Fellowship. My PhD was in the area of looking at an Ayurvedic curriculum for medical education. I've been practicing Ayurveda for over 25 years, and I'm a certified TM teacher as well as a Maharishi Yogasana teacher. And it's just a joy and privilege to be part of this program, and welcome to everyone.
Dr. Leslie Elder.
Hi, my name's Leslie Elder. My training is in family medicine, and I am a adjunct associate professor in the program on the faculty. Great to see you all.
Okay, thank you all. Okay, so the Fellowship MS in Integrated Medicine and Ayurveda for doctors and advanced practice practitioners. This is a unique program that we have at MIU. It's the only recognized integrated medicine fellowship in the country that focuses on Ayurveda and probably the world as far as we're aware. MIU, Maharishi International University, is the largest provider of Ayurvedic education and training in the West. We have 5 or 6 degree programs, 700 students, all fully accredited. So it's a real powerhouse in that area, and we go back many, many decades. A lot of experience. And this fellowship is fully recognized, as mentioned by the American Board of Integrated Medicine, which it falls under the American Board of Physician Specialties. To be eligible for the fellowship, one needs to be a licensed healthcare practitioner, a MD, DO, nurse practitioner, PA, naturopath, chiropractor, doctor of Chinese medicine, dentist, a doctor of physical therapy, doctor of psychology, and there's probably 1 or 2 classes that I missed. Those are the groups who we admit to this program. We have other programs that admit people interested in Ayurveda for who have other types of credentials. Okay, our fellowship is unique in that it blends Ayurveda with general integrated medicine. Okay, so the fellowship is 2 years online part-time. And it takes about 10 hours a week of your time. It's all asynchronous learning. Whenever you want to do your work, you can. So it's intended for people who are already in practice, who, excuse me, it is intended for people who are in practice currently to enable them to stay in practice and get their fellowship training without having to leave their practice. And the curriculum consists broadly of two components. About half the curriculum is Ayurveda, which comes from us naturally at MIU. And the other half of the curriculum is general integrated medicine, sort of a Western approach to holistic care. For that part of the curriculum, we license curriculum from the University of Arizona. University of Arizona has decades of experience in integrated medicine training. So you really have the A team collaborating together, two institutions at the top of their fields collaborating together to provide this fellowship. Now, all of the learning in the program is asynchronous on your own time, about 10 hours a week, except every other Thursday night at 7 p.m. Central, there's a 90-minute webinar, live attendance required. And then we have on-site clinical training 1 week, 1 week each year, 2 weeks total, mandatory. And it's good that it's mandatory because you don't want to miss it. It's a real highlight. Dr. Leslie Elder will be telling you about it in a few minutes. This year, the clinical week will be the week of October 12th in Fairfield, Iowa. So as soon as you get off this webinar, get that time off of work. Okay, so the curriculum at MIU, we are on a block system. And so when you sign up for the fellowship, you're going to be taking essentially 23 courses, one after the next, over 2 years. Okay, so this gives you an overview of the first year's curriculum as an example. So if you sign up for this summer, which I encourage you to do, then the first course will start I think it's the 17th of August. Introduction, it's an introductory course, basic principles, and then a whole systems course. And each course lasts 3 weeks, 4 weeks, 2 weeks, 5 weeks, depending on the course. Then a whole system of medicine. We'll learn a little bit about naturopathy, Chinese medicine, and the like. Introduction to mind-body medicine, then a nutrition course, an environmental health course. Lifestyle medicine, 5 sense therapies, botanical foundations, integrative medicine, medical and legal issues. That'll take us to Mayish, and then we'll switch gears and turn to the organ systems, musculoskeletal system, cardiovascular system, GI, hem-onc, rheumatology, neurology, dermatology, all through the organ systems through the end of the course. And as we go through each organ system, pathophysiology, management from both general integrated medicine and Ayurvedic perspectives, all integrated together into both, all integrated together into each course. Now, when I talk to people about the fellowship, there's three things that I strongly recommend, that I strongly emphasize. Number one is we have a very strong emphasis in our fellowship on self-care. So there's a big emphasis on taking care of ourselves. So we all learn, everyone who comes into the fellowship learns TM, Transcendental Meditation. We all meditate. We learn the yoga asanas, we learn the pranayama, we learn the diet, we learn the daily routine, we learn how to use the herbs, and we do these things on ourselves and our own health, and we all evolve as we go through the program in our own health and wellness. So the program is intended to be personally transformational, and our graduates tell us that. That's our hope, that the program should be that way, and the knowledge base, the Ayurveda, is very profound, and we are simply the conduits, and as the faculty, are the conduits, and the fellows tell us things like this. This is from a capstone presentation from one of our fellows. I'm healing by doing my assignments at school, because a lot of our assignments are experiential. I'm healing by doing my assignments at school. Beautiful. And here's that quote. Now, a second thing that I like to emphasize about the fellowship, personally transformational. Number one. Number two, at the same time, extremely practical. This is not an ivory tower operation. This is extremely practical. Our faculty, we are experienced clinicians, and we all have experience integrating the material into routine allopathic practice. I worked as a primary care physician at Kaiser Permanente for 30 years and put a lot of energy over a lot of years into integrating this into practice. So you will be learning how to integrate Ayurvedic and holistic modalities into your practice in a very pragmatic way, starting from day one. Diet, herbals, mind body, five sense therapies, exercise, evidence-based referral guidelines, and the like. Very practical. It will transform your practice, and you will be looking forward to going to work to see your patients and share this profound knowledge with them. The third thing I emphasize when I'm talking about the program is pulse diagnosis. Pulse diagnosis, there's an Ayurvedic therapeutic and diagnostic technique, pulse diagnosis, which enables us, once trained, to detect imbalances in the physiology before they manifest as disease, and from there prescribe individually tailored prevention and management programs. And you'll learn pulse diagnosis in great detail in your fellowship, and Dr. Wegman is going to talk about that in a few minutes. So I'm going to now pass the baton to Dr. Leslie Elder, who's going to tell you about one of the great highlights of the fellowship, which is the residential clinical weeks. You are on mute. Very good.
Hello, everyone. Welcome. So glad you're here. The clinical week is really, many of our fellows tell us that is the highlight of the fellowship. And we really engage in hands-on learning during the clinical week, which is so important. It's one thing, to gain intellectual knowledge about Ayurveda, just to learn about it, but it's a whole other thing to really incorporate it into your life. That's much more challenging in the busy Western society we live in. And so over the decades, all of the faculty here have really learned how to integrate Ayurveda into our own lives and also the lives of our patients, how to teach them how to integrate Ayurveda into their lives. So during the clinical week, we share with you practical ways to incorporate Ayurveda into your life and the lives of your patients through all sorts of modalities, through diet, through meditation with TM, through yoga, pulse diagnosis, and the five sense modalities such as aromatherapy, Gandharva Ved music, Abhyanga, the self-care, the self-massage, all of these things you are going to be learning how to do and how to teach them to your patients. During the clinical week, we're going to really be learning how to easily and quickly prepare fresh cooked meals that will have a balancing effect on your for all body types. Here we are in the kitchen. We have a kitchen that's available during the clinical week, and we make the most of using it. Here we are showing fellows how to cook demo meals. People really get involved and have hands-on experience cooking, and like I said, learning hacks of how to quickly prepare fresh meals that are balancing for all body types. It's such an important part of Ayurveda is the diet and eating freshly prepared foods with lunch, the main meal of the day. All of these concepts, we really delve into this and make it so that it can become a reality in your lives and the lives of your patients. So here we are, fellows, getting into the action, and it's really kind of like a family environment with like cooking together with a family, and we have a lot of fun. we learn how to make spice mixtures individualized for your individual constitution that it will work to balance. Just as you're eating, you can be balancing your physiology. We uh, we also talk about all the different grains and legumes and which ones are balancing for which body type, which spices are balancing for which body type. It's really fascinating, and people are really immerse themselves in this knowledge. And here we see on the right, we have a lot of deep learning that goes on that really directly relates to what we're to how we're incorporating Ayurveda through meditation, etc. Here we see a fellow, and she's sitting there and she's hooked up to a ECG, EEG lead that Dr. Fred Travis has put on her. He's a faculty member, a neuroscientist, and he has done a lot of research on the EEG patterns of people that occur when they're engaging in different types of meditation. So, and he has found that actually the EEG patterns are different for different types of meditation, and we talk all about that. And and so when you're meditating, you're doing transcendental meditation, and you actually, when you are transcending, you actually can see that in the EEG pattern. It's very fascinating. Next slide. And here we see the fellows on the left learning pulse diagnosis. You know, pulse diagnosis is a very profound technique, a part of Ayurveda, and it was very close to being. This technique was close to being lost after the colonization of India. It was really a lot of the traditional practitioners of Ayurveda were the knowledge was being lost because of a political situation in that country, and so Maharishi Mahesh Yogi, the founder of the TM movement, he really gathered many doctors and many doctors from the traditional Indian families who had passed this knowledge of Ayurveda down through generations, and just to really revitalize Ayurveda and revitalize the technique of taking the pulse, Ayurvedic pulse. So here the fellows learn how to do that first on themselves, and then they practice on other fellows, and then they also begin to practice on patients that we have here in our clinic here in Fairfield, Iowa. So, and then on the right, you see fellows learning about aromatherapy and the different blends that you can make to balance certain conditions. So we also learn how fellows are given everything they need to start doing Abhyanga, which is amazing, to start doing the sesame oil massage, which is so you can use other oils also, but they learn how to do that on themselves. So that's really an important modality that they start to embrace. Okay, so the next slide. So here we are. This is our first cohort that came through at the end of the clinical week, the first clinical week, and we have a banquet towards the end of each clinical week at the Raj, which is a Panchakarma center, which is located very close to the university, and we really celebrate the knowledge that we've gained and the bonds that have formed between the fellows. These are bonds that they really strengthen over the years through the in-person webinars and the clinical week, and just through, we have WhatsApp groups, and they stay in contact over the years. So it's really a way to bond with like-minded professionals and to support each other and their desire to incorporate Ayurveda into their practices. So it's really a wonderful thing. And so they always hope to keep that interactions going, you know, even after they've graduated from the fellowship. Such a good way to get support from other practitioners. Okay, so now we're going to have Dr. Shankari Wegman elaborate more on our program and hand you over to her.
Thank you so much, Dr. Leslie and Dr. Charles. It's such an honor to speak to all of you. Right now, we're about to graduate our second group in about a week. So we've been meeting with all of our with our current fellows, and it's just inspiring to hear their journey, as Dr. Leslie and Dr. Charles have kind of mentioned how transformative it is. And I think part of it, as kind of was touched upon, is there's an element of inner work that also happens in this program. And I'd love to just share a little bit about the approach from our university. So our approach is really based on consciousness. It's a consciousness-based education approach at Marshall International University, and it really emphasizes the development of consciousness alongside everything that we're learning outside. So we're really cultivating that inner field. And here we really recognize that there's this infinite field of creativity, infinite field of happiness, infinite field of well-being and intelligence within. And our mission is really just to enliven that field along with everything that we're learning. So part of that is that everyone here learns transcendental meditation as part of the program. It's covered within the program cost in and of itself. And this is something that we all practice together. And I'm just going to share my PowerPoint here. And Dr. Charles, this is something you can all see, right? Okay, great. So you can see here is one of the buildings at our university. This is where we all come together. We sit and eat together when you come for our residential clinical weeks. Here at the university, we just also really emphasize the inner development, the development of consciousness alongside everything that we're learning. And this, what it does, it allows for more of a holistic experience of everything that we are learning. We're absorbing it internally. And part of that is this experience that we have in our meditation. Transcendental meditation is one of the most reviewed and extensively researched systems of meditation for over 50, 60 years. There's over 350 peer-reviewed documents benefiting, showing the benefits in all areas, such as supporting a decrease in anxiety, depression, PTSD, increased optimized brain functioning, better cardiovascular health, increased creativity. So many different markers of health and well-being have been seen in this practice. And there's a beautiful quote that I'd love to read from Dr. Norman Rosenthal, which says that if a pharmaceutical company had a pill that was capable of doing all of these different benefits, all of these different things, if they had all of these studies showing how much help it could give, that pill would be $1 billion blockbuster. And this is really something that we incorporate as part of our fellowship. And it's really one of a kind training for healthcare professionals because it's so oriented in self-care and as well as using evidence-based practices for mind-body medicine. And part of that is this meditation technique. And this is a huge epidemic that we know with healthcare professionals who are experiencing burnout. And in so much, this technique allows for a practical way to help reduce stress, increase resilience, really helping to restore the body's inner, balance. This is why we see that these are our 10 program goals. And as Dr. Charles mentioned in the very beginning, it's very oriented for self-care as well. You can see in these 10 program goals, I won't go into all of them, but I'll just focus on the first 3. And the first is to facilitate whole person health for our patients. So you might come into this thinking, what more can I give my patients? What more can I offer them? And this is what the fellowship really, that's one of the main goals, is to really address all the different factors that influence wellness, looking at the mind, body, the spirit, the environment. And the second is also practitioner self-care, so that the practitioner experiences whole health themselves by engaging in all these different activities of self-care practices. And from that, then we go into relationship-centered care so that there is a deep therapeutic partnership between the provider as well as the patient. This is why when you come to the clinical weeks, you can see here we have some of our fellows from our first cohort practicing pulse diagnosis after we do our yoga together in the morning. We meditate together, we do our breath work together, and then we also do taking pulse together. So this is very practical. It's very deepening of that experience. We also have different activities in our clinical week where we make these different concepts that might seem very abstract, very concrete. You can see here the fellows are going around touching different substances, trying to understand the gunas or these qualities that are part of taking the pulse. And we learn how to take our own pulse from the very beginning. As soon as you start the program, we start this knowledge of pulse diagnosis within the first course, and we deepen that knowledge by taking it on ourselves with our patients. So we start right away with the practicalities of how we can help ourselves as well as our patients. And before I turn it over to Dr. Charles, just want to say this whole science of Ayurveda is something that we integrate into the fellowship with integrative medicine, and we show all the different practicalities and all the different modalities of Ayurveda, from aromatherapy, yoga, the herbal supplements, the botanicals, the diet, so many different ways to allow the practitioner to fill their toolbox to offer all of these different ways of whole health for their patients as well as for themselves. We're so excited to welcome all of you to the program and look forward to any questions. I'll turn it over to Dr. Charles.
Thank you very much, Dr. Wegman, Dr. Leslie, and for all of you for your attention. We have a question in the chat about examinations. Is any exam to get certificate? Okay, so this is an accredited master's program. So after each course, during each course, there are assignments, and there's an exam at the end of each course. On the Ayurvedic side, the course is pass-fail. So there is work to be done. Everything is pass-fail, and each course is pass-fail. So it's not high pressure, but yes, there are exams. In the Arizona curriculum, there is an exam to take at the end of each module on their platform. You need to get 70% to pass. And if you don't pass, you can take it 2 more times. And if you don't pass it 3 times, then you get a review and we get an oral exam. So yes, there are exams. No, it's not a pressure cooker. At the end of the 2 years, there is an Ayurvedic final exam and there is a general integrative medicine final exam. Again, needs to be passed, but not a pressure cooker. And then in order to become board certified, MDs and DOs in North America will be eligible to sit the certification exam offered by the American Board of Integrative Medicine. And there you go. And so then that exam does need to be passed. That our fellowship qualifies you to take that exam, and then you need to pass that exam to become board certified. I'm applying for your PhD program. I'm reading from the chat in medical physiology and would like to know about your fellowship program as well to consider it too. That's great, and we would love to have you. I do not recommend both the fellowship and the PhD program at the same time. So the PhD program is a research PhD program to give you research skills. Excellent program. Dr. Sandy Nedich heads it. Highly distinguished researcher. Outstanding, outstanding. If you want to learn how to do research, in our program, you're going to be learning integrative medicine. We do have a capstone project, about 100 hours, under the mentorship of one of the faculty. And we have lots of faculty available for mentorship depending on your interests. So there is research experience and opportunity for research growth in the fellowship, but it's not the developing research skills is not the main focus as much as clinical skills. Is there any board certification for nurse practitioners? is a question in the chat. Our program is the only integrative medicine fellowship that offers a master's degree to everyone. So everyone gets a master's degree, which is a credential for everyone, including the people who aren't eligible to sit the ABOIM boards, nurse practitioners, naturopaths, PAs, chiropractors, get a credential in the accredited MS degree. There is no board certification in integrative medicine in the nurse practitioner world that I'm aware of. Questions? Other questions? I have a question for my colleagues, if no one else has a question. And my question is, this has come up recently, why should people learn Ayurveda as opposed to some other type of integrative medicine? Why do we care about this?
Okay, I can answer that. I think if you want to learn natural medicine, this is the place to come. It's not like it's particularly, Ayurveda just means knowledge of the lifespan in Sanskrit. So you're learning about life and about how to balance your life. And this is really at the foundation of what you want to learn when you learn about natural medicine, because it's not only you're balancing your life, but it provides you with the tools of how to teach this, how to do it yourself with yourself, and also how to teach how to attain that balance. That's what natural medicine is all about, is attaining balance through natural means by diet, your daily routine, your modalities, herbs, rather than using maybe something that would be too strong or a little too strong. We want to work with the body. And so this is just this incredible, rich science that's thousands of years old, but yet modern at the same time and very cutting edge. It's many of the modalities of Ayurveda have been, there's been published research on these modalities that they're very effective. And so it's an ancient science, but yet very modern. It's also consciousness based. That's huge because it all comes from that same very deep and profound field of consciousness. And it comes out of that. And it's in that way, it's very profound and it just stays young. It's for anyone. You don't have to be Indian, it's for anyone. And it's just so wonderful to be practicing Ayurveda because it's all integrated within itself. It's not like you just pick something here or pick something there. So I think if you want to learn natural medicine and really the best way to offer it to your patients, I think you've really come to the right place. Our course, that's what we offer. And there's doctors, I remember hearing an older doctor who had been practicing for many, many years, allopathic medicine. And he said he never really understood the human body until he took the course in Ayurveda that was offered at that time. He never had really understood the human body until learning Ayurveda. And that's, really jaw-dropping. So that's why personally, I think we're really offering the best of the best. So hopefully you will choose our program because that's what we're looking for. We really want to stay on a very high level, and it's a very profound program.
We're offering the best of the best to the best. And
That's right.
that's you. And our fellows, boy, they are quite a group of people, amazing group of people. So I encourage you to apply right away because it's ridiculously easy. And the deadline is approaching. And there is in the chat a link to our website. You can apply from there. It'll take you 20 minutes to apply, maybe 25. It'll cost you $20. Then you send us a transcript, a CV, a copy of your license, of your active license to practice, whatever it is that you practice, as a PA, as an MD, as a DO, as a naturopath. Then you'll have an interview with a faculty member. That's it. And as we get into June and July, we're very busy, so please take care of it now. The link is in there. There is a merit scholarship program available. First come, first serve. The link is in the chat. My email is in the chat. We're available to answer your questions. Anything else anyone wants to ask before we break?
There's a question in the chat about the cost of the program, Dr. Charles, if you might.
Yes, thank you. So the program, the total tuition cost of the degree is $36,000 over 2 years, $9,000 per semester times 4. And that includes, number one, it gets you a master's degree, an accredited master's degree, in addition to board eligibility in integrative medicine. Number two, it included in that is your transcendental meditation instruction course fee, which we asked you to complete the course before the start of the program, and certainly before the clinical weeks. The usual fee for that is in the range of $900. Number three, it includes your room and board. When you come on campus for the 2 clinical weeks, you'll need to get yourself there, but you'll be given a private room and delicious meals and won't need to cover any of those expenses.
Dr. Charles, there's a comment I'd like you to make because I listened a few times to your journey, how you started in a very large health network, one of the largest health networks in America, and you had an incredible journey of actually introducing Ayurveda into your regular practice in that network, and maybe it would help everyone to get a sense of how this all works when you're actually out there in the field and trying to introduce this in a large group of medical doctors, and you had great success with it.
Yes, thank you. And I'm just looking at a question that popped in, which is related to what David's asking. As an MD, how can I start incorporating in my clinical practice without getting MD license in trouble? Do MD needs to get ABIM certificate before practicing? Would it fall under scope of practice? Okay. So the MD license is a universal license. You can do what you want. And if you're practicing good healthcare for your patient, you're not going to get yourself into trouble. One needs to use good clinical judgment and continue to practice good allopathic medicine. No compromise of the standard of care. To the contrary, we're raising the standard of care. Someone has musculoskeletal pain. We're going to give them an NSAID. Hey, I have a better idea. Why not use turmeric or boswellia? They work very well and they're much better safety profile. That's evidence-based. So someone can challenge you on it if they want. They're not going to win that argument. Okay, it's better medicine. People are having problems with gut problems, say with irritable bowel syndrome, and they've been scoped, they've been scanned, they've tried multiple medications, and they come to you, and you're going to have learned dietary principles that are going to enable you to help that patient with just diet alone. There's no risk at all. So the things that we're learning, they integrate very well into routine clinical practice. Of course, we use good clinical judgment. The herbals as well, evidence-based, common sense. There's nothing that we're learning that should present a problem for your license, assuming you're practicing good medicine and taking good care of your patients. When I first started at Kaiser Permanente in the 90s, this was off the table. Nobody talked about integrative medicine. Over the years, I started integrating this into my practice. I got permission from my superiors to do some Ayurvedic consults on a few of my patients. Why? Because it was driving me nuts. They weren't getting better the allopathic tools weren't working. And I had other tools to use, and why shouldn't I tell the patient just because it's not fashionable? So I got permission to do it. I documented good patient satisfaction. It grew into a consult practice, which by the end of my 30 years there was 40% of my practice. My colleagues sending me patients, gastroenterologists, endocrinologists, sending me their patients who they needed our help with. And I would have irritable bowel, the irritable bowel, functional bowel example is a good one is we actually had a corridor arrangement where the GI department would send us the functional bowel patients. They didn't want to see them. We did because we could help them. And they would get better. And sometimes they would copy me their charts. Patient would come back to see them. Patient got better in integrative Ayurveda clinic. Thank you. And copy me the chart. No kidding. So very compatible with Western medicine and allopathic care, regardless of your care setting or specialty. Other questions?
I think there's also a question, Dr. Alka said, as an MD, how can I start incorporating in my clinical practice without getting MD license in trouble? I think you've kind of mentioned that, but
Yeah, I think I hope I included that question in my answer there.
because the second part is, does an MD need to get ABOIM certified before practicing? And would it fall under the scope of practice?
I think ABOIM will help you to get jobs, and this is a developing story. So the American Board of Integrative Medicine is about a decade old, and there are 23 fellowships now. And so that credential will, I think, help you get work more and help you to um, sell your ideas and yourself to your health system and to your colleagues. I don't know that it's completely necessary in order to start incorporating integrative modality. To me, integrative medicine and really integrative Ayurveda I'm a primary care doc, is primary care expanded, just a different style, a different emphasis. So yeah.
Hi, my name is Yamuna. I'm one of the pediatric cardiologists. How you're in primary care, so how has it been with kids? How would you do the practice with the kids in your group, with the
Oh, very
children?
nice. Right. There are a lot of applications to taking care
Uh-huh.
of children. And so you said you're a pediatric cardiologist. Okay, so
Yes.
taking care of kids get sick too, and as you know, and there are a lot of very practical, simple things, diet, mind, body for the child, and
Uh-huh.
then as you know, for as you know better than I, you need to manage the family often, depending on the age of the
Yes.
child. And so it gives you just a whole new set of tools. We have pediatricians coming through our program. We have a general pediatrician who graduated. We have a pediatric endocrinologist in the program now. And you have my email. If you'd like to talk to these people,
Yes. Yeah.
please email me and I'll put you in touch with them. But very practical for kids. In my practice as an internist, even the pediatricians were sending me patients. And the main reasons
Good.
that
That's
as
great
an
to hear.
internist, yeah, it would surprise me. And and the main indication, the main reasons the pediatricians would send me patients were gut problems,
Mm-hmm.
abdominal
Mm-hmm.
pain, digestive issues, number one. Number two, ectopic dermatitis, allergies, and that spectrum. And then very commonly, uh, kids with ADHD where the parents were refusing to medicate.
Yeah. Okay.
Yeah.
Yeah. Thank you so much.
Mhm.
Two more questions in the chat, Dr. Charles. There's one from Dr. Alka. Are there individual courses for few body systems such as GI health, skin, etc., instead of the whole 2 years? And the second from Dr. Shini is, how can NPs utilize this knowledge and degree in their practice without a board certification? Also, how is this program different from functional medicine?
Okay, first question. So at this time, we are developing a short course. a 20-hour course as an introductory course for people who aren't quite ready for the fellowship. It's going to be a little while before it's ready, this short course. But uh, what we have found, to be honest, is that the 2 years is good. I know it seems like a long time, Dr. Alka, but for many, many decades, our organization offered short courses in Ayurveda to doctors. We did that for 30 years, multiple generations, 40-hour courses, 60-hour courses, 20-hour courses. And the long and short of it is it didn't work. It wasn't enough exposure to stick. So I just so um, it's really the in-depth exposure is necessary to because the process, as my colleagues mentioned, of absorbing the material into your being. It does. I mean, you can't. There's certain things, you can pop a TV dinner in the microwave, but if you want to bake a pie, I mean, it's got to be in there for an hour and a half, right? You just can't toss it in the microwave. Things take time. So the 2 years uh, is important. Now,
I'm
the
just say,
nurse,
so I'm going to add something to that.
please do.
That I also think that this time right now is so much more conducive to for doctors to get the training and to get out there and start practicing it in their practice because there's so much more demand for it now than there used to be. And there's so much more acceptance of natural medicine than 30 years ago. It's just back in that time when a lot of doctors were being trained in these short courses, there just wasn't they couldn't do it in their practices. But now it's really becoming a reality where people are able to, actualize themselves as a natural practitioner. And it's just not such a, I mean, it's different in different parts of the country, but it's a good time. The time is now to embrace this and to start offering it. This is the time. So I think you're also fortunate to be interested at this time. It's much more doable now.
Thank you. And for Shiny's question, how can a nurse practitioner utilize this knowledge and degree in their practice without a board certification? Okay, so I'll answer your question, Shiny, and then um, once again, my email is in the chat, and if you email me, I will put you in touch with nurse practitioner graduates who will tell you their experience. But one of the things that's fortunate about our program is that you'll get a master's degree relative to other fellowships where you wouldn't. So you'll have, in addition to your nurse practitioner credentials, a fully accredited master's degree in integrative medicine and Ayurveda. And so this is a credential that will help to back you up. It's very practical. And again, how much, you know, a lot of the things that we're going to be teaching that you'll be learning are ridiculously simple and hard to argue with. And there will be other things that you'll learn that are more esoteric and where you'll use your clinical judgment where and when to use them. But telling people, in allopathic medicine, we don't learn anything about diets. Zero in med school, zero. You'll learn a lot about how to tell people to eat, how and when to tell people to exercise, about chronobiology, we call it in Ayurveda dinacharya, about some very simple detoxification techniques, about really some evidence-based herbals, really ridiculously simple things that you can use anywhere and only a really crazy person would argue with. So it's going to expand your toolbox. Not and as mentioned, so it'll expand your toolbox and you will be viewed wherever you're practicing as an asset because people who come in to other doctors, they have no idea they don't know anything about herbs, they don't know anything about diet, and you'll be there to offload those patients and your practice, it'll take 3 to 5 years, and then you will be really wildly busy with integrated medicine patients. Oh, how is this different from functional medicine? Okay, so functional medicine is a subtype of integrative medicine. In functional medicine, it's a style of holistic practice. Shares a lot in common with what we do, but is also quite different. What it shares in common is in the philosophic or theoretical framework, we're looking for the root cause, holism, and treating the root cause and looking at the patient in a holistic way. Where it differs is in the approach, where ours is fundamentally consciousness based and how to say, in functional medicine, as it pans out in practice, they do a lot of labs. It's very biochemically oriented. Lots and lots of labs, lots and lots of supplements. That isn't necessarily inherent to the medicine, but that is the style of practice. And many of the labs are unconventional. And so I couldn't practice functional medicine where I worked because it was on the surface of it too unconventional. Because the labs, I couldn't even order the labs. They weren't available in our lab. So complex lab assessment, more complex herbal regimens. We try to keep the herbs simple and a big emphasis on mind, body, diet, daily routine. Slightly different emphasis in style and a lot in common in theory, really very different practice patterns in practice. It's a very good question. Okay, anything else? Other questions? We've gone quite a long time. Would this be difficult to add to a telehealth mental health practice? Mostly the pulse diagnostic portion. Well, right. If you're seeing the patient online, you can't take their pulse. Okay. So just like anything else, it's preferable to see the patient at least once in person, unless you're in a telehealth practice. And you can't, but you can still do it. There are other ways of determining the body type, the the current imbalance, the state of their digestion through the history and the physical, and you're still getting a new paradigm that will contribute to better care for your patients. So telehealth shouldn't stop you from taking the fellowship if you're committed to 100% telehealth. Is it possible to independently practice after fellowship without certificate for a foreign graduate? Okay, so our fellowship is not a shortcut to physician licensure in the United States or to licensure as a nurse practitioner or any other category. So it does not shortcut any of the licensure requirements or any of the requirements that you would otherwise have to get your license. Now, if you took our fellowship, is it possible to practice as sort of a wellness consultant in the United States with just this training? It depends on the situation and where you live. Pretty complicated question, and we should talk about it offline depending on your situation. Dr. Mills has chimed in regarding functional medicine. I had this as part of family medicine residency that I was program director for. It's wonderful in many ways, but not as holistic as Ayurveda. It has some similar aspects, but is not so intentionally mind-body. Very concisely and accurately put. Thank you. Anyone else? Okay. Well, why don't we break then? I want to thank everybody for attending.